Hello everyone, myself Deepa Singh, working as assistant professor in Gandhia School of Pharmacy, SGVU-Jaipur. Today we discuss about next unit of industrial pharmacy, that is parenteral products. In this lecture, we discuss about introduction part of the parenteral, what is a parenteral products, different classification, properties, advantages, disadvantages, and some excipient that is used for manufacturing of this parenteral product on the for particular formulation according to different parental products. So this is the next unit of industrial pharmacy, and in this we just cover introduction part and some another matter of parental product. It is a subject of topic of industrial pharmacy, one subject fifth semester. In this, before starting this topic or this lecture, you should know about the basic learning objects. In this learning object, first is what are the parental dosage form. Means you should know about the different parental dosage form, and these parental dosage form comes in which category or the classification, and what are the parental dosage form. So all this we know about in this lecture, or complete information regarding this parental dosage form. Next are the various types of a parental dosage form. This is available in different types. Mainly there's two types: large parental volume and small parental volume products. So you should know about these types of parental product, or what is the difference between these product or types of this parental dosage form. Next are the what are the application and rationale of different parental dosage form. Means why this parental product you use, or how you use, or different application or purpose of these parental products, and rationale of different parental dosage forms. Means purpose or rationale of these parental products, and what are the advantages and disadvantages of different parental dosage form. Every formulation or every dosage form have a different disadvantages, or have at least one or two disadvantages. So you can know about some disadvantages or advantages of this parental product, and what are the formulation consideration of parentals. For parental product, you take more precaution or require more aseptic or more good condition compared to other formulation. It is a very sensitive or susceptible formulation. Don't manufacture in any condition. There's a more precautions required for manufacturing of these parentals. So what are the formulation consideration or condition that are required for manufacturing of a parental product? How different parental dosage form are prepared, means after maintaining this condition, how we prepare this parental product. All this in this topic or in this lecture. So these are the learning objects, and in this introduction part of the parentals. So parental are the sterile solution or suspension of the drug in aqueous or oily vehicle. Means it's a mainly liquid dosage form and available in both solution and suspension form, or you can say that containing drug in aqueous form or oily vehicle. And parenteral drug are administered directly to the vein and muscle or under the skin or more specialized tissue such as spinal cord. You know that different parental routes, and according to these parental routes, you can select any one route or specific site to administer the drug. So these parental route is given by different route or different sites according to route of administration, and in this it is given by vein or muscle or under the skin. Means you can say that vein, muscle, or under the skin. You can say apply this injection, and more specialized tissue such as spinal cord or spinal tissue also given by this injection. And term parental use for any drug fluid whose delivery does not utilize the alimentary canal or entering in the body tissue. Means the parental drug use for this administration or parental drug or fluid whose delivery does not utilize any alimentary canal and for entering in the body tissue. So these parental rules are mainly used for this type of the formulation, this type of the problem. And general requirements of parenteral dosage form. There is some specific conditional requirements are very necessary to manufacture these parental product, and more precaution or more condition requirements are necessary for parental. So these are some conditions required for parental product manufacturing or parental product. In this, first is stability. You should proper maintain stability condition of the product should be stable form or free from any contamination or any material, or it should be stable, because if all material is formulation stable, then it may be reaches to particular desired condition or for particular expiry date. Otherwise, there may be chances that it can disintegrate within a few minutes, or not a few minutes, but few days or few months. So it should be in a stable form, or you can check stability of your formulation or individual excipient as well. Next is a sterility. For parental manufacturing, you should sterile complete environment where plants, equipments, and excipient all are required in a sterile condition. So sterility is also one of the most important parameters for manufacturing of a parent drug. You should maintain the sterile condition of your formulation, including plant, equipments, container. All these are should be in a sterile condition, including excipients, and free from pyrogen and toxin, because any of the pyrogen, toxin, or any material is present in your formulation within your excipient, so it may be degrade or contaminate your complete formulation, or there may be chances that it can affect a particular patient after administration, because your drug is directly goes in your blood. So there may be chances that it can show more problem. So it is free from pyrogen and all type of the toxins. And next, and this free from a foreign particle. No any foreign particle or unwanted material should be present in your formulation. It should be completely sterile or complete clear solution, and free from all the foreign material. And isotonic, it should be isotonic or should maintain the tonicity according to body requirement, according to blood. So it should be isotonic. If it's not a high isotonic, so it may be show some serious effect in your body after administration if you are preparing isotonic, not a proper isotonic formulation. Next is chemical purity. Chemical purity is also another important parameter that you should maintain. If there's any impurity or any material which is not pure form or maybe toxic present in your individual excipient or in your formulation, then it degrade your formulation as well as show more toxic and side effects in your body, or more effect which is not required or undesired effect to your body. So these are the general requirements for parenteral dosage form. Next, in this parenteral routes, there's a different parenteral routes are available for administration of these parenteral products, and the term parenteral literally means to avoid the gut or GI tract, refer the any route of the administration outside of the beside the alimentary tract. And means in this avoid the gut or showing the first pass effect is the avoid, because when you are taking your drug by oral route, it shows first pass effect. So you avoid the first pass effect or directly reaches your drug to GI tract when you administer a drug by parenteral route, or refer to any route of administration outside or beside the alimentary tract. And in this, the parenteral are the injectable drugs that enter the body directly and are not required to absorb in the GI tract before they show their effect. Means after administration of this drug or injection, your drug directly enter your body and show the desired required effect, and it is not absorbed because it directly reaches your blood circulation and show the effect, and also take less time compared to oral administration. So these routes are more appropriate for showing fast effect or desired effect, because absorption step is not observed and drug directly reaches to your blood circulation or in the body. And in this parenteral route of administration usually have a more rapid onset of action. Means more or large onset action or required action is observed in this route compared to other route or compared to oral route, and it show or require very less time when you give the drug by intravenously. So maybe it show fast effect or effect within the minutes, and other parenteral route is also good for fast effect compared to other route or compared to oral route, and these are the some advantages, and these are the routes for parenteral drugs. In this, first is intravenous, second is intramuscular, subcutaneous, intradermal, intraarterial, intracardiac, intrathecal, intracisternal, peridural, and intraarticular, intracerebral. So these are the parenteral route, or you can give the drug by particular route, particular site. Now we discuss this one by one. First is the intravenous. This is the fastest route, and the injection of a drug directly given into patient vein and resulting the more rapid of the action, hence directly given this drug to vein of the patient or into the vein, and this is the fastest route and show the more effect when given by this drug to vein, and this is the good route. And next is intradermal route, and in this you can see the images or diagram of this administration. different layer, or according to type of this parental route, you are injecting the injection at different site. And this you are injecting the drug in a vein. Next is intradermal, and in this drug is injecting this dermis layer and injecting the top thin layer of the skin. Ideally, drug is placed within the dermis and used for diagnostic agent, means for checking of the drug. And you administer this drug into your upper layer or ideally few layer of the skin and place within the dermis only. Next is subcutaneous. Subcutaneous injection of the drug under the skin into the fatty layer. This is a fatty layer, and you administer your drug in this fatty layer when you are administering the by subcutaneous route, but not into the muscle. And absorption of the drug is rapid by the subcutaneous route also. And you injecting your drug under the fatty material, not in to the muscles. Next is intramuscular. In this intramuscular drug are injected deeply into the muscle tissue if the drug is in aqueous water solution. Means your drug suppose in a muscle tissue, given your drug into a muscle tissue, or in the drug in aqueous form or water soluble solution form. And in this intramuscular route, absorption is also more observed or rapid is observed. And however, if the drug is an oily liquid or in the form of suspension, means you administer a drug in the form of mainly oily liquid solution or water soluble solution or in the form of suspensions also, and it prolong the release of the drug. Means when you administer the drug by intravascular route, it show more effect as well as prolonged effect of particular drug is observed. Next is intra-arterial injection. These injections are given directly to the artery, and this is mainly for particular desired effect or required effect. And next is intra-arterial injection. These injections are mainly administered for emergency use or fast effect of particular drug. And these are given in the heart muscle or ventricle at the time of the emergency, means heart muscles or ventricle. And this is mainly used during the emergency. And intra-arterial injection, these are given in the subarachnoid space and surrounded by spinal cord, and these is used for spinal anesthesia. Means you can say that this is have a specific use, or these route used for a specific purpose like anesthetic effect on the spinal cord or on the spinal area, and this is given by subarachnoid space that's surrounded by spinal cord. And next is interstitial injection. These are given in between the first and second cervical nerve, used to CSF for diagnostic purpose. Means this is not for some effect or desired effect, but for diagnostic purpose. So this interstitial injection is used, and this is given between the first and second cervical nerve, and for diagnostic use of the CSF fluid. And peridural injection, and these are given between the dura mater inner aspect of vertebra, used for a spinal anesthesia. Yes, this injection is also used for anesthetic purpose or spinal anesthesia, and this is administered or given between the dura mater insert aspect of vertebra. And next is intra-articular injections. These are given into the articular end of the bones in a joint, means between the joints of intra-articular ends, and used for lubricating the joint. If some person or old age patient have some joint problem or bone problem due to reduce that lubricant or less concentration of the lubricant present. So in this condition, these articular injection are given to the articular end of the bones, and this improves the lubrication of your bone for providing a lubricant effect to the joint. Next is intracerebral injection. So these are given in the cerebrum, means in brain or cerebrum area. So these all are the routes that use for parenteral administration or parenteral formulation. So these are the next advantages of the parenteral formulation. And this useful for a patient who cannot take drug orally. Many patients have a problem or don't take oral drug, maybe unconsciousness or some nausea like feeling or some another problem. So in this condition, these drug is given by parenteral route or drug taken by this parenteral route or by the injection. Next is rapid onset of action. When you take your drug by oral route, it takes more time or produce effect after so many times. or require long time. And when you administer these drugs by parenteral route, so by parenteral route, it show more effect or fast effect or rapid onset of action observed and useful for emergency situation. Suppose patient suffering from some emergency condition or emergency problem, effect is required within the minutes, then this parenteral route is required, or you can administer drug by parenteral route during the emergency situation. Next is providing sustained drug delivery system. Suppose you are require sustained release or control use or for longer period of a time effect, then in this condition use parenteral drug, and in this mainly implants and depot injection by intramuscular route you administer. And next is avoid first pass metabolism. Yes, first pass metabolism is also avoid or skip by this parenteral route. Drug directly reaches your blood circulation, and no first pass effect is observed by this parenteral route. And next is can inject drug directly into the tissue, that is target drug delivery. Means according to different parenteral route, you can administer your drug at particular site or required site, or directly target drug delivery is possible with the help of this parenteral drug administration. And in this next is useful for delivering fluid, electrolytes and nutrients in emergency condition or maybe during dehydration or any other problem. And not only specific for drug, you can also administer some another contained or maybe formulations like fluid containing formulation, electrolytes and nutrients also by the help of this parenteral, and as well as its a fast effect. Next is can be done in hospital, ambulatory infusion centers and home health care centers. It does not require that you administer these drugs only in hospital, but according to suitability or some condition that is required for administration, you can administer these drugs at different condition or different place, like maybe hospital or ambulatory infusion or centers, and like home health care centers also for complete viability. So these are the advantages of this topic. Next is disadvantages part of parenteral formulation, and disadvantages pain on injection. Some patients have a phobia for injection or having a more problem during administration of this injection. So pain is observed, or he or she or that particular patient suffer that particular pain during the injection administration. And next is difficult to reverse an administration drug effect. In oral route, it slowly release drug, but maybe can reverse somehow of that drug. But after administering drug by this parenteral route, it is difficult to reverse the drug effect. And next is sensitivity or allergic reaction at the site of injection. Some person have a very sensitive allergic skin type, and after administration of the drug by particular route, that particular site have some sensitivity reaction or allergic reaction to that particular site. Next is require strict control of sterility and non-pyrogenicity than other formulation. Means you can control sterility as well as some non-pyrogen condition is required. You should take more precaution or extra precaution for formulating this type of a formulation to maintain the sterility or to formulate your product for pyrogen free. And next is trained person is required. No one give the injection by parenteral route. Some doctor or trained person or nurses are required for administration of the drug by this route. So trained person is required. And next is required specialist equipment, device, technique to prepare and administer the drug. Means suppose you are preparing, then in this condition more specific condition, equipments and technique are required for parenteral formulation compared to other, as well as administration is also not possible directly. There's a needle or syringe is required. When we compare oral, there's a less condition is required and even take without any specific condition. And administration of drug is also very easy in oral compared to parent. So in this condition, special equipments, device and technique are used to prepare as well as administration condition also. Next is more expensive and costly to produce. Means when we can say that these parenteral products are more costly or expensive or extra care is required when we compare with oral formulation and any other formulation. So it is a more expensive and costly product. Next is classification. In classification, it is divided into two categories, two parts. One is a small volume parenteral Second is a large volume parenteral. So now according to type of the formulation, you can formulate your parenteral product within a small volume or within a large volume. And it's a Venn diagram. Suppose there's a primary infusion is here. There's a strike and this is a band. And this is a drip chamber. And this is a control pen. You can control the speed of this fluid infusion. And control clamp is here. And this is a tube that helps to transfer your drug or any material or any fluid or nutrients to this tube. And inline filter is this, and injection site is this, and middle adapter and protective cap that you administered into the skin. So this is a Venn diagram that show the parental administration, or you can also know that what are the parental administration, how you administer. Now in classification, first is a small volume parenteral. Small volume and large volume, just name itself say that difference is only the quality or some excipient, and not quality but quantity. As a small volume have a small condition contained or capacity, and in large volume it have more capacity. So now we discuss a small volume parenteral. According to USP, small volume parenteral as an injection that is called as a containing 100 ml or less. Means if your formulation capacity have a 100 ml or up to 100 ml or less than 100 ml, then you can say that these are the parenteral or small volume parenteral, because it label as a 100 ml or less than 100 ml. In large volume, according to this, large volume parenteral are designed as to provide fluid, calories, dextrose solution, electrolytes, combination of these, and volume up to 101 to 1000 ml. Means more than 100 ml, starting from 10 to 1000 ml between formulation of parenteral come in a large volume parenteral category or large volume parenterals. And in this mainly you don't administer the drug, but formulation or manufacturing of this large volume parenterals like fluid or calories. In this calories maybe dextrose solution or electrolyte, maybe during dehydration condition or any other condition, more supplement or more electrolytes or more solution fluid is required. Then you can prepare this large volume parenteral or require this large volume parenteral, and the capacity is also too large. You can see like some saline solution, and these capacity is 101,000 ml, or maybe you prepare combination of these above fluid, calories and electrolytes also. So according to USP, difference is that 1 to 100 ml is come in a small volume, and 101 to 1000 ml come in a large volume parenterals. And these small volume is mainly for medicament purpose or containing drug. And this is mainly fluid, calorie, electrolytes type formulation. And this is the difference between small volume and large volume parenteral. In this first is volume, a small volume is 100 ml or less than 100 ml. In large volume 101 to 1000 ml. Route is intravenous, intramuscular, SC, and large volume IV. And for non is IV, LV. Large volume parenterals, and dosage unit is a single or multiple. Small volume mainly prepare for single injection, single administration, or maybe multiple. And these large volume for only single injection or single formulation. Means these large volume is not contain any medicament formulation, but electrolytes fluids are administered by single purpose or single use only. Next is preservative is used, but in large volume is not used because it's a single in use. Next is buffer. This is also used in the small volume, and in large volume it is not used. And in formulation, it is available in solution, emulsion, and suspension form. And in large volume, it is available in a solution form or maybe OW or oil in water nutrient emulsion. Means some solution or nutrients are prepared only in large volume. But these small volume may be in a solution form, emulsion form, or suspension form, because it contains medicament or multiple use or maybe single use. And isotonicity is not essential to maintain, but in a large volume, we should maintain isotonicity according to body requirement. Next is pyrogenicity, not essential to maintain a small volume parenterals, but in a large volume parenteral, you must be maintain the particular pyrogenicity. Your product should be free from pyrogen or don't contain single pyrogen material. Next is a use therapeutic and diagnostic purpose. These are small volume parenteral mainly required to show the particular effect or desired effect or therapeutic effect or maybe for diagnostic purpose, but this large volume formulation is required for administration of nutrients, detoxification, and during the surgery. Next is the formulation, how you formulate or which are the excipient that you use for formulation of this parental product. So these are some example of this formulation or excipient containing the parental formulation. First is the aqueous vehicle. In aqueous vehicle, water for injection, that is according to USP, highly purified water used as a vehicle injected for preparation which is subsequently sterilized. Means this water for injection is a purified form and available for injection as a vehicle or vehicle injected for the preparation and subsequently sterilized. You should sterilize your formulation and your excipient, and a USP requirement include not more than 10 parts per million of the total solids. Means this is a limit or condition, or you can say limited criteria that can be accepted according to USP. It is not more than 10 parts per million of that particular solid. And pH of this aqueous vehicle water for injection is 5 to 7. That is approximately weak acidic or maybe a neutral condition. And water for injection is maybe prepared by either distillation or reverse osmosis. These are the technique or two method that is used to prepare sterilized water or distilled water or while preparing water for injection with the help of distillation and RO condition, that is reverse osmosis. And stored in a chemical resistance track. Stored after distillating or after preparing this water for injection, you should store in a proper condition, because if you are not maintaining the proper condition, there may be chances that your product degrade or water for injection contains some impurity or contaminating material due to improper storage condition. So you should store in a chemical resistance tank. Next is bacteriostatic water for injection. So these type of water are used to making parenteral solution prepared under aseptic condition and not terminally sterilized. Means it is also one pure form of the water, and these water used for making the parenteral solution or parenteral formulation, and it is prepared by aseptic condition and not terminally sterilized condition, but you prepare in a sterile condition. Aseptic condition, and need to meet USP sterility test. There's one sterility test given in USP. After preparing this bacteriostatic water for injection, you check the sterility condition or condition for sterility of that particular water. That is given in USP, and it meets that criteria of USP, and it contains added bacteriostatic agent when in the container of 30 ml or less. Means you use some bacteriostatic or preservative in this type of the water for injection, and container is approximately less than 30 ml or up to 30 ml. Next is a sterile water for injection. This is also water that is used for manufacturing of the injection formulation, but as a sterile condition. And this sterile water for injection containing one or more suitable character bacteriostatic agents. Means it is also have some preservative or bacterial resistance agent, and multiple dose container not exceeding 30 ml. If you are preparing multiple dose, then the volume should be within the 30 ml or up to 30 ml, not exceeding this 30 ml. And they are permitted to contain high level of a solid water for injection. Means quality is also high when you use for water for injection or comparing water for injection type of the water, and because of possible leaching, and used for washing bound surgical incision or body tissue. Means this is not used for administration purpose, but as a used for some another purpose of washing purpose, like washing bounds, surgical incision or before operation, and body tissue also. So it is also directly come contact with your body tissue or internal body parts, or some cleaning purpose of surgical incision or bounds. Next is a water miscible vehicle. So this water miscible vehicle is a number of a solvent that are miscible with water, has been used for portion of a vehicle. Name itself say that it's easily miscible or solubilized in water. So these water miscible vehicle are easily miscible with water and used to portion of a vehicle, and primarily to affect the solubility of a drug and to reduce the hydrolysis. Means when you prepare water for miscible vehicle, then your solubility of a drug is more and don't affect the formulation and reduce by hydrolysis. An example of this water miscible vehicle is like ethyl alcohol, liquid propylene glycol, glycerin, ethyl alcohol used in case of cardiac glycoside. These are the example. Next is non-aqueous vehicle. In this non-aqueous vehicle, fixed oil mainly used or oil type of the solution mainly used. In this fixed oil, vegetable origin, liquid, rancid, resistant, unsaturated, and free fatty acid content are mostly used for fixed oils. And other than this, you can also use peanut oil, corn oil, cotton seed oil, sesame oil, soybean oil, or ethyl oleate or isopropyl myristate. So these are the example of non-aqueous vehicle that you use for your parenteral formulation. Other additive in this antibacterial agent. This is not required for both small and large, but it depend on the type of the formulation or maybe single dose or multiple dose. It acts as a preservative for stop the bacterial growth or kill the bacteria. So it is also known as antibacterial agent. And these are added in a multiple dose container. Means suppose you are preparing a dosage form which is administered in multiple times or not prepared for a single dose. So in case of a multiple dose formulation, it should be mandatory or you add this bacteriostatic agent for multiple dosing. Next is to prevent microorganism growth. Means if you can say that some microorganism growth is possible in your formulation. So in this condition, to stop this microorganism growth, you can add this bacteriostatic agent. Next is limited concentration of agent are used. The concentration of these bacteriostatic agents should be in a limited condition or according to the specified or required condition. This capacity is mentioned in your pharmacopoeia, and you take this bacteriostatic agent according to given volume or given in a pharmacopoeia. And in this example of this bacteriostatic agent in a concentration according to first is the phenyl mercuric nitrate and thiomarizole. Concentration is 0.01%. Next is benzoconium chloride and benzoconium chloride. Concentration is also same 0.01%. Next is a phenol and cresol. Concentration is 0.05%. Next is chlorobutanol. Concentration is 0.05%. So this is used for very less concentration or very small amount for act as a bacteriostatic agent or antibacterial property. And concentration, these are specific given in a specific pharmacopoeia, and it is a very little amount of small concentration for antibacteriostatic property, antibacterial agent. Next is a buffer. Buffer, you know that used for maintain the pH. So it is added to maintain the pH of your formulation and to stabilize the solution from chemical degradation, means to form a stable formulation or prevent from chemical degradation. And citrate or acetate buffer are the example. Sodium benzoate and benzoic acid is another. Sodium tartarate and tartaric acid. Next is a phosphate buffer. So these are the example of buffer. You should prepare according to requirement or according to body requirement and maintain that particular pH of your solution. And for maintaining the pH of that particular formulation according to requirement, use buffer or adjust the pH with the help of buffer. Next is the antioxidant. It is another excipient used for the parenteral formulation. Antioxidant is to protect the formulation from oxidant. Name itself say that it is helps to protect the oxidation reaction. This is known as antioxidant, or this is helps to protect your formulation from oxidation. Next, these are the two types. And this first is reducing agent, second is blocking agent. In this reducing agent, there are many examples. And reducing agent first is ascorbic acid. Second is sodium biphosphate, that is 0.01%. And next is thiourea. And next is a blocking agent. In this blocking agent is a tocopherol. So these are the two type of antioxidant, reducing agent and blocking agent, which help to prevent the oxidation reaction or act as an antioxidant. And these are the example of this antioxidant. Next is a surfactant. Surfactant is also another excipient, and it's also very important to maintain the proper formulation, reduce the surface tension or tonicity of your formulation. And in this, solubilize the effective ingredient. If your drug or any ingredient which is insoluble in condition, then with the help of this surfactant, you can easily solubilize for enhancing the solubility of all ingredient, including API and excipient. This surfactant is also used. In this, for solubilizing the active ingredient, example of surfactant is like polyoxyethylene and sorbitol monoolate. And next is tonicity agent in this. need to isotonic solution to avoid destruction of red blood cells, irritation and tissue damage. If you don't formulate your formulation in a proper isotonic condition according to your body requirement or isotonicity, then there may be chances that severe problem or condition may be occur. So you should prepare a formulation in a proper isotonic condition. And if you don't prepare in this condition, there may be chances that your RBC or red blood cell get destroyed or irritation or some tissue damage is observed. Next is a more important for large volume, rapidly administered and extravascular injection. Means this tonicity adjustment is not necessary for all the formulation, but this is very important, or you should maintain this tonicity for large volume parenterals or rapidly administered type of the drug or extravascular injections also, because directly administered or come in contact with your blood. And next is reduce the pain on injection. This tonicity is also used, or tonicity agent is also used to reduce the pain during administration or during the injection. Example of this tonicity is dextrose, mannitol, and sorbitol. These are the conditions if you are not maintaining the formulation in isotonic condition. If you are preparing, suppose, hypertonic solution, then your RBC gets shrink because your water content or H2 get removed through this RBC. And if you are preparing hypertonic solution, then there may be RBC that swell or show more size because it takes more water or H2O. And in this, there may be chances that it can burst. So you should prepare your formulation in an isotonic condition for proper comfortable effect or suitable desired effect. Next is a chelating agent. This chelating agent is mainly used to prevent your formulation for chelate formulation and to remove the trace element that catalyze the oxidative degradation. Ethylene diamine tetraacetic acid is the example of this chelating agent. Next is a co-solvent. This is also solvent or acts as an influence of property or solubility. Then you add this solvent or combination of some solvent, then the solvent is known as co-solvent, and in this co-solvent is used to improve the solubility of your formulation and prevent the potential for hydrolysis. Suppose there's hydrolysis reaction is observed in a formulation or solubility problem is also observed, then you can use this co-solvent. It improves solubility as well as hydrolysis reaction. It's a bulking agent. In this, maybe use some another excipient for as a bulking property. In this, for freeze drying purpose, preparation of a solid, mannitol, dextrose, sucrose, and dextran use. Some parental formulation are available in powder form, and these type of formulation you convert in the solution form with the help of water for injection or any other solvent. And these are stored in a freeze condition or in a cold condition. And when you prepare this powder into a solution form, then you administer. So in this, for freeze drying powder solution or powder, use some mannitol, lactose, sucrose, and dextran type excipient. Next is a suspending agent. In this, DMC carboxyl methyl cellulose, gelatin, and sorbitol used. Means mainly polymers are used for the suspending agent of the parental formulation. Next is emulsifying agent, and this emulsifying agent example is lecithin, polysorbate 80. So these are the example of this emulsifying agent. This is all regarding the introduction part of the parental formulation, including introduction, definition, advantages, disadvantages, and different foods for parental. And formulation in this, we covered a different excipient that you use for your formulation, including large volume and small volume with the example. So after completing this topic or after ending of this lecture, you should know about these learning outcomes or basic object outcomes. So these are the outcome in this parental product definition, introduction part, then what are the parental product and rational implication, advantages and disadvantages part, purpose of formulating or manufacturing of these parental products, and the application means uses why use only these parental products, advantages and different disadvantages of these parental products, route of administration, how you administer this parental product or different route for parental administration of the drug. And the next is factor affecting parental preparations, formulation consideration. In this formulation consideration, a vehicle means what are the excipient used. We already discussed these vehicle. aqueous as well as non-aqueous, additives or maybe excipients, which excipient you use for your formulation of parental, including small volume or large volume, which is suitable for small volume and large volume, you should know. And the types of parental preparation in the small volume, large volume, other than this, solution, emulsion, suspension, and dry powder means because this parental formulation is not only available for small and large volume as well as in powder form, suspension, emulsion form. So you should know all these parental formulation also. And quality control we discuss in the next lecture. So in this lecture, we covered the introduction part and some example of excipient or formulation parameter required for manufacturing, including classification of this parental volume, small volume and large volume, difference between these large volume and small volume, including rationale of this parental product, advantages, disadvantages, and application of this parental product. After completing this learning outcome, next part is the reference. These are the reference for this topic. Answer pharmaceutical dosage form drug delivery system. 8th edition by Leo V. Allen, Nicholas G. Popovich, Hawa C. Answer published by BI Publication Pvt Limited. And next reference is a textbook of physical pharmaceutics by C.V.S. Subramanian, published by Balla Prakashan. Next is the theory and practice of industrial pharmacy by Leon and Lackman, Habers, L. Lieberman, Joseph L. King. 3rd edition published by Bagrissi Publishing House. Next is a Martin Physical Pharmacy, Pharmaceutic Science, 5th edition by Patrick J. Singh, published by Lippercott, William and Wilkin. So these are the reference for this topic of our parental. All reference are good. You can use any one reference or in a combination for that matter. So this is the reference part. After referencing, there's a question part or question which is similar or depend on in this topic of parental formulation. After completing this lecture or complete understanding of this lecture, you can easily answer this question. In this first question is sterility test, pyrogen testing, and leakage test, clarity, and particulate analysis. These are the test or condition which is required to check for parental formulation. And in this, there's a 4 option. You can select any one correct answer which is suitable or correct for this question. In this option is disadvantages of parental preparations. Next is the type of sterilization. C is a non-aqueous solution is to overcome what? Next, D is a quality assurance of the parental product. So these are the 4 options. Next is non-pharmaceutical additives. In this non-pharmaceutical additive, here is the formulation ingredient must be highest watt and lowest watt. Additive means ingredient or excipient that you use for your formulation. So in this second question, you can select any one correct option which is suitable for non-pharmaceutical additives. In this A option is the pharmaceutical ingredient must be of highest watt and lowest watt. In B option, what parental watt is to be most common for all injectable products. And C option is a process in which you can produce product that loves the dry state and is a since large volume of the fluid is administered, what must be they not be contained. Next is the third question in the substance such as solution, bandage, baby bottles, nipples, etc. In this 4 option, A option is why must parental product be sterile. B is how does ionizing and radiation kill, and C is the application of ionizing radiation. D is the quality assurance of the parental product. Means these type of the formulation comes also a sterile condition of parental product, or this solution also covered in a sterile condition. So there's a 4 condition that you should maintain or overcome the problem if it have a bacteria or not in a proper sterile condition. So there are 4 options. You can select any one correct option according to proper answering of third question or according to sterility condition of the solution. Next and 4th question, the nature of preparation and its ingredient. A option is how does ionizing radiation kill? There is a filtration and sterilization result in what? C is what are the formulation ingredient, and D is what does sterilization method depend on. So in this, you can know about the nature of each and every ingredient or excipient as well as API, and according to this question of excipient, you can select any one correct answer out of this ABCD option. Next is the 5th question. In this, which property measure the resistance of a liquid flow? A is the density, B is the viscosity, C is the volume, D is the solubility. So these are the 4 options which is suitable for property measurement of a liquid flow. You can select any one correct option for this 5th question. Next is 6th question. What is the correct definition of the pseudoplastic liquid? Is a liquid become a less viscous as the rate of shear increase? B is the liquid which become more viscous at the rate of shear increase. And C is the liquid which become less viscous over the time when the constant shear stress is applied. And D is the liquid which become more viscous over time when constant shear stress is applied. So this is the sixth question. Now in seventh question or next question, which of the following excipient may be used to limit the presence of microorganism in liquid formulation? In liquid formulation, parenteral formulation, you can know which excipient to use or which is the main important parameter or which excipient is the more important for microorganism stop or act as an antimicroorganism or presence of microorganism in liquid formulation. In the option part, seventh question is purified water. These are sodium lauryl sulfate, C is a benzoponium chloride, and next B is the ascorbic acid. Next is the eighth question. In the eighth question, what is the role of xanthan gum within some liquid formulation? So you know what is xanthan gum, or it is also considered excipient that is used in a formulation. So after knowing this, you can also know the property or role of that particular xanthan gum. In this, A is to regulate pH, B is to control viscosity, C is enhance solubility, D is enhance stability. These are the four options. According to this, you can select any one correct option. This is appropriate for a xanthan gum. Next is the ninth question. In this, of the following oral liquid formulation would be considered as orthogel for orphanagel formulation. So there's a four option: A is the syrup, B is the elixir, C is a mouthwash, and D is a linctus. So these are the four formulation. According to orphanagel formulation, you can select any one correct option out of this four option. Next, last 10th question is aspartate is an artificial sweetener. As the main disadvantages is you should know about artificial sweetener or aspartate because we already discussed these an example of this aspartate which is used in a particular formulation. So after knowing this aspartate has some serious or more toxic or side effect. And out of this four option ABCD, you can select which is the disadvantages of this aspartate. In this, A option is carcinogenic. B is a metallic aftertaste, C is a bitter aftertaste, and D is a hygroscopic in nature. So these are the four options or four disadvantages. And out of these four disadvantages, you can select any one correct option from correct disadvantages, which is suitable for your aspartate as artificial sweetener. So these are the questions related to parental formulation or this topic or introduction. So in this lecture, we cover introduction part, including advantages, disadvantages, application, classification, and difference between small and large volume parentals, and some excipient for formulation of this parental formulation with the examples. So next, we will continue this parental product in the next lecture. So thank you so much for watching and listening to this video. Thank you, everyone.